Have you ever felt like you would stand up, your heart would start racing for no reason, like you would feel like palpitations, mainly when you're standing or doing some sort of activity, or maybe you stand up and you feel like you're about to pass out, or maybe you have completely lost consciousness and you go to the doctor. They do an echocardiogram, which is like an ultrasound of your heart, and that comes back fine. You're not crazy, because what you could be going through is something called autonomic neuropathy or dysautonomia. Hello, my name is Darcy Marie, and I was actually diagnosed with dysautonomia or autonomic pre-syncope, or like some pre-syncope condition in 2007 when I was like 14 years old. And now they want to rerun a tilt table test again. And in addition, have an autonomic function sweat test. So basically, you could be going through something called dysautonomia or autonomic neuropathy, which is actually, rather than a heart structural problem, meaning the echo is fine, the ultrasound of your heart is fine. They do not see any problems such as heart disease, a hole in your heart, anything that would explain that's coming from your heart itself. But you could have a malfunction in your nervous system. Yes, the nervous system that controls autonomic functions. And what I mean by autonomic functions is like internal bodily functions that work automatically. This is like your heart rate, blood pressure, and a host of other things like sweat production. You may sweat too little, you may get overheated easily, you may sweat too much, and related things like that. So the truth is, you are not crazy if you are told that your echo is fine. And October is actually Dysautonomia Awareness Month. And with that being said, just because there's a certain test that showed everything's fine does not mean it's all fine. It just means that they were looking in the wrong spot, or they're trying to figure it out. So, with that being said, autonomic function testing consists of like things like the tilt table test that will trigger these autonomic functions, and to see what your blood pressure and heart rate's doing when you're having these tests, like the tilt table test. They'll monitor your blood pressure and heart rate and stuff while you are laying onto a table. You will be strapped onto a table and not being allowed to move. And they will up it, elevate it, and they will continue monitoring in these different positions. And come to think of it, how many doctors think of monitoring or checking your blood pressure or heart rate when you're standing up? Or how many doctors think about checking your orthostatic vitals in different positions? Hardly any. Most of the time, your heart rate and blood pressure are checked when you're just sitting in the doctor's office, right? So, as stated before, for it to be autonomic function, you would have to, for it to be autonomic dysfunction, you would have to actually check your heart rate and blood pressure in different positions, and stuff like that. So, autonomic dysfunction or autonomic neuropathy is kind of multisystemic. Autonomic dysfunction or autonomic neuropathy or dysautonomia, whichever term you use for it, it's all like means the same thing. Have you ever felt like this sense of tingling in your extremities, and they call that neuropathy? Autonomic neuropathy is along the lines of that, but it's part of your autonomic nervous system. And with that being said, this is the part of the system that controls vital organs, heart rate, blood pressure, digestion even, and sweating production, temperature regulation, and stuff like that. So, now that I covered all of that, that's just what it is. So, yes, you can have a structurally normal heart, no sign of heart disease, none of this, because it's not really a heart-based problem. It is a nervous system problem. Okay, this is why your echoes appear to be fine. The ultrasounds of your heart appear to be structurally normal, nothing like that. But yet you have heart palpitations, you have irregular heartbeat, you have a host of other symptoms of feeling lightheaded, dizzy, or even passing out, and stuff like that. And a lot of times when it comes to dysautonomia or autonomic neuropathy, there's a more chance you're being labeled as kind of like schizo or crazy when you see the doctors, because none of them seem to even check for your orthostatic vitals and your orthostatic intolerance. So there is basically different forms of autonomic neuropathy or dysautonomias. There is a lot of different types, okay? There's orthostatic intolerance, there's orthostatic hypotension, which means when you're upright, your blood pressure tends to drop really low. This can lead to like fainting or passing out when you're standing. There's postural orthostatic tachycardia syndrome, which is kind of similar, but it's characterized where your heart rate is too high when you're standing, okay? And you feel lightheaded or passing out, or like stuff like that. But we must remember that it just doesn't affect your heart rate and blood pressure. It also affects your digestion. So people that have IBS, irritable bowel syndrome, can also have this issue. Or have difficulty sweating, can also have POTS, or postural orthostatic tachycardia syndrome, or orthostatic intolerance, because it can affect throughout your system, your bodily organs, and stuff like that. So anyways, this is my little take on what it actually is. Explained in detail the best I can. And so yeah, that's what dysautonomia or autonomic dysfunction is. So anyway, I'm gonna cut it off now. So bye.